Thank you all for coming and joining for the talk today. The talk is entitled A 21st Century Approach to Development, and this is by Joshua Kaufman from USAID's Global Development Lab. I'm going to introduce Joshua in one moment, but I have a few announcements that have been passed to me regarding the speaker series and our upcoming student internships. The WDI student-initiated internships application process is now open, and the application deadline is Thursday, February 11th. You can visit our webpage for more information, and if you have any questions, Cinia will be available after the talk, and Cinia is over here raising her hand, so if you're interested in the internship application process, talk to her. The second announcement is our next WDI Global Impact Speaker Series will be on Wednesday, February 17th at 5 p.m. The guest speaker will be Ray Cummings, who's the director of the Market Dynamics Group at PATH. PATH is an international health organization driving transformation, innovation to save lives in low-resource environments. And now I have the distinct pleasure of introducing our guest tonight, Joshua Kaufman. Joshua serves as the director of the Office of Evaluation and Impact Assessment in USAID's Global Development Lab. Prior to joining the lab, Kaufman served as deputy director of the agency's Office of Innovation and Development Alliances. He's been with USAID for a while, since 1996, and he's worked for many years in the agency's Center for Democracy, Human Rights, and Government. He served in several different leadership roles, including the head of the Information Unit, team leader for global and regional policy, and division chief for strategic planning and research. From 2011 to 2013, he served as co-chair of USAID's Policy Task Team for Democracy, Human Rights, and Governments, and he led efforts to craft the agency's first global strategy in that area in 19 years. He has a master's degree in international affairs from George Washington University, and he has a bachelor's degree in politics and peace and conflict studies from Brandeis University. Today, Josh is going to be talking about and sharing how the lab is applying science, technology, innovation, and partnerships to accelerate impact in response to the unprecedented global development challenges we're facing today, including shifts in capital flows, technological breakthroughs, a new culture of innovation and social entrepreneurship, and massive acceleration of connectivity. We at WDI are very excited to be working with the lab. We're working with them in pioneering some new and practical ways to assess hard-to-measure results. We, as in the Performance Measurement Initiative at WDI, myself and my colleague Yakuta Fatehi. And these are focused on trying to enable quicker learning and adaptive management from data. So with that, I'm going to turn it over to Joshua, and thank you very much.
Great. Thank you, everyone, for coming out. I hope you could hear me because I'm literally wearing two mics, which is a new experience for me, so hopefully at least one of them is working okay. And thank you for coming out tonight for what I hope will be a really interesting discussion about what I consider to be the most exciting thing that's happened at USAID and the broader development community over the last 20 years, which is the establishment of the U.S. Global Development Lab, but more broadly sort of a new culture of innovation and risk-taking and experimentation that's really taking hold throughout the agency. I could go ahead and do a lecture, but I also would actually prefer taking questions and having discussion as I go on. So please don't feel shy to sort of throw out a raise your hand or shout out. That really gives me a better sense for what's interesting to you rather than have me talk for 40 minutes and then do 20 minutes of Q&A. I'd much rather have a dialogue. What I do want to make sure we cover, though, is why was the establishment of the U.S. Global Development Lab necessary at USAID? Why was it so important for us as an organization? But also, what were the trends that were happening in the world that made it the right time and really an obvious decision to establish an organization like the lab? And then I'll go over a little bit of our operating model and talk about the principles that sort of a 21st century development principles. And hopefully do a little bit of a deep dive in some of the areas that the lab's working in that I think would be most interesting to you all, including some of our open source innovation tools, looking at some of our public-private partnerships, our support of social enterprises and social entrepreneurship. But also, like I said, I really encourage people to sort of shout out if there's something that you want to know or something that sounds interesting. So mostly I'd like to be sort of forward-looking. What are we doing now and what are the implications going forward? But I want to begin a little bit by looking back to, again, put in the context of why it was so important to create the lab. And I'll use my career a little bit as a straw man to sort of show what was going on within USAID at the time that the lab was created. So I joined USAID in 1996, so almost 20 years ago, as a democracy, human rights, and governance officer. But even a few years before then, sort of maybe our story begins a few years before then, and let's say in 1989, which may be ancient history to a lot of you. But what was going on, if people remember, or if you were taught, at the very end of 1989 that was of such huge historical significance? Berlin Wall, yeah. So Tiananmen Square, which didn't have such a happy ending, the fall of the Berlin Wall. For me, that was all very important because sort of this was when I went off to college. So this was my freshman year, and all these amazing things were happening, and it really seized me. Like personally, this was what I wanted to do. I wanted to do something that was going to help support the rapid spread of democracy and freedom. And through undergraduate school and grad school, this was really what I wanted to do. And by the time I was finished with my graduate degree, I knew where I wanted to do it. I wanted to do it at USAID. We had a new administrator at the time who came from a democracy and governance background, and he established almost right away as a core U.S. government development objective supporting democratic governance, which really, we were the first donor to have done that. And it was a big deal. It was a real shift within the agency. And that was right around the time I joined. And it was super exciting. It was everything I wanted it to be. It was an opportunity to be creative. And because so much of what we were doing had never been done before, we were inherently, even if we didn't realize it, being innovative. And I thought, because it was my first exposure to working for the federal government, that that was normal, right? That's how it worked. Turns out it doesn't really work that way. And after a while, we went from operating sort of outside the box, because there wasn't a box, to building our own box, right? And we did all this creative work, and then we sort of started using the same tools that we had developed, the same way, in the same places, and largely with the same partners to help us implement the programs. And I realized that wasn't probably such a good thing. And it actually was pretty true across the other parts of the agency as well. So it certainly wasn't just around democracy work, but in terms of health and our agricultural work, et cetera. And if you thought about it in terms of, say, a large consumer goods multinational firm, if you weren't doing product development, right, if you didn't have something built into your systems to allow you to innovate and to do research and development, then you probably wouldn't be successful over the long term. And I kind of worried that that was a little bit of where USAID was. But I certainly wasn't the only one. I think there was a broad acknowledgement around 2010 from within the agency and some key external stakeholders that indeed we had to become more of an innovative organization. And that really accelerated with the arrival of our administrator, Raj Shah, who was an alumni of this institution, who really came on board and made innovation one of his key priorities. And so when he started starting up some organizations within sort of hubs within USAID, I jumped ship, which for me was a big deal. I thought I was going to do democracy my whole career, but I realized that innovation and instilling an attitude of risk-taking and experimentation was really important if the agency was going to accomplish all of its objectives. At the same time, the world was changing, and largely in some really positive ways that made it important for USAID to change if we were going to stay relevant. When we started as an organization over 50 years ago, the vast majority of capital flows into the developing world were from donor assistance. World Bank, IMF, USAID, et cetera. By 2010, less than 10% of those flows. So a huge sea change. The vast majority was foreign direct investment, diaspora flows, et cetera. And if we didn't figure out, and all of those sources of resources were having a huge development impact, oftentimes positive, sometimes not so positive. And if we didn't figure out how to align ourselves with those new sort of actors in development, we were not going to be particularly relevant. And at the same time, you had this massive democratization of information, massive spread of mobile phone subscriptions, internet connectivity, which was really empowering, and a rising middle class was empowering individuals throughout the world to become their own development actors and their own development champions. And if we couldn't work with those individuals and those multinational corporations really effectively, then again, we were going to miss huge opportunities to successfully accomplish our mission. That just sort of shows what I said, that there's development assistance is now a tiny little piece of the pie. And again, just sort of as a proxy for the massive technological change that last year, for the first time, there were more mobile phone subscriptions in the world than people, and that so much of that growth is being fueled in places that USAID really cares a lot about. Sub-Saharan Africa, the poorest parts of Asia, Latin America. The economists called the spread of the mobile phone the most important development advance since the seeds of the Green Revolution. And I think that's true. And we'll talk some more about that. We also are dealing with intractable problems. So while there's all these great opportunities, we've been working on some of these problems for literally generations, and we still haven't solved them. And so we really, again, needing to raise our game and wanting to not keep doing the same thing the same way because it wasn't yielding the results that we wanted. Let me talk a little bit about the lab's operational model and what our goals are, and then, like I said, I'll go through sort of these values of a 21st century development approach. So the lab was established in 2014, in April 2014, so we're not yet 2 years old. We're the newest part of the agency. And we have a two-part mandate, two main goals. The first, which is sort of source, test, and scale breakthrough development innovations and solutions to improve the lives of millions of people. One way to think about this is we're the research and development arm of USAID. Right? So part of what we're trying to do is discover and source new solutions, and to do it by engaging with a wide variety of actors. Anyone in the world could solve a development problem, and we want to figure out how we could tap into that creativity. The second objective is to establish sort of a series of tools around science, technology, innovation, and partnership, and make those tools available to the rest of the agency, the broader donor community, with the belief that if they're utilizing those tools, they'll achieve better development outcomes, sort of better, cheaper, faster is our mantra. So we want to accelerate the transformation of the U.S. development enterprise. Our business model is relatively simple. Most parts of the agency, for really good reasons, when they're developing or designing or starting a new program, picks a single sort of bets big on one approach or one solution, and does that for a long period of time. So it might be a really long, big grant to use a particular implementation model, say for malaria treatment, and it might be like a 5-year program. So the lab turns that on its head, and we start out by trying to come up with hundreds, maybe even thousands of good ideas and solutions, and we want to be rigorous about testing them, right? And we want to be a little bit ruthless. We don't want to get attached to them. And the ones that don't work, we get rid of as soon as we can. And the ones that do work, we try to support. We provide larger amounts of financial support. We provide sort of structural and organizational support with the hope that, through iteration and testing and evidence, we'll come up with a very small number of real huge wins that have the capability of impacting millions of lives. So in some respects, and we'll get into this a little bit, it's a venture capitalist sort of pipeline approach to it. So I want to quickly go through, or not so quickly, some of them I'll spend more time on than others. But these are the principles that we're trying to apply that we sort of say would be the mark of a 21st century development enterprise. And the first one I actually want to spend probably most amount of time on because it's cool and people like it. And it's also probably the most successful part of our model so far, which is our open source innovation tools. And what I mean by this is, again, it's the recognition that great ideas could come from anywhere. And the way that AID is set up is, generally speaking, and especially before the lab was founded, the barrier of entry to work with USAID oftentimes is impossibly high, right? What we require of organizations that want funding from USAID, sometimes there's only a handful of organizations in the whole world that have that capacity. When we're talking 100-page or more proposals, costs a lot of money, you need to speak our language, all these things. But what it meant was we were largely working with the same organizations over and over and over again. And we wanted to try a new approach. So what we did is we created a bunch of different tools, such as Grand Challenges or Development Innovation Ventures, which are some grant programs we have, that lower the barrier of entry, that make it extremely easy to apply. So instead of like 5 or maybe 10 applications, we would get 500 or 1,000 applications. It meant a lot of late nights for the people that had to read the applications, but so far it's been wildly successful in that, and I'll give some examples in a second, we have sourced some really hugely creative ideas from people that in a million years never would have ever thought of applying, much less getting money from USAID to work on development issues. But let me first hand out a couple of them because they give you a better sense. Some of our innovations. I picked these, well, one, because they were small and they fit in my carry-on luggage. But two, because when we talk about our innovations, a lot of times people think, oh, well, you're paying for technology that's going to be really expensive, it's going to break, People aren't going to know how to use it. And some of our best innovations are service delivery, behavioral economics, new models, and not necessarily technologies per se. So I'll pass these out. I do need them back. But let me tell you what they are before I pass them out. So these things are called Pratt pouches. Right? And it looks like a ketchup pack. Here, I'll pass them out. And it kind of is a ketchup pack. But instead of ketchup, it's antiretroviral medication. And the reason that the Pratt pouch is potentially a breakthrough is, and by the way, the Pratt pouch was developed by undergraduates at Duke University. And the reason why this is potentially a game changer is, so there's a 1 day's dosage of medication that could be given to an infant by, in this case, actually by their mother rather than a trained medical professional, that over the course of 2 weeks will prevent the transmission of HIV to that child if their mother is HIV positive. So one breakthrough is it's really easy. The mother could do it. They don't need a trained medical professional. The real breakthrough is it doesn't require refrigeration. So it has the potential to replace a treatment course that requires refrigeration, which means that that mother, right after giving birth, has to walk with her child, sometimes hours and hours, to a health clinic and somehow figure out how to stay there for 2 weeks because that's where the refrigeration is and that's where the medication is. Pratt pouch will, depending on the climate, 6 to 12 months it's good before it deteriorates. So at any point during the pregnancy, the mom could walk, or the dad or whomever could walk to the clinic, get 14 of them, bring them home, and when she gives birth, she could administer it to her child once a day for 2 weeks, and it prevents transmission. The second one is a winner of our newest grand challenge called Securing Water for Food, and it's pretty self-explanatory. It's called Real Garden, and I'll pass these out. And I actually have I have a brown thumb, not a green thumb, so I actually want to steal some of these and take them home because you'll see when you look at them. They're basically made for subsistence level or smallholder farmers. And we liked them because it allows you to grow crops using 80% less water than traditional methods. But you'll see it, all it is seeds and a piece of paper with explanations on how to grow. And I think I passed out 5 different crops. And some of them are actually sponsored. So there's some chili peppers that are sponsored by Nando's, which is a South African chicken chain that has spicy sauces. But you'll see when I don't even have to explain it, but it literally, in idiot-proof way, tells you how to plant these crops, and it spaces them the exact amount apart, and it tells you when to water them and how much sun to have, and et cetera. And then the last thing is it's a packet of an antibiotic ointment called chlorhexidine that you should be able to buy if you go to CVS. So again, we're not talking like a huge, giant innovation. But what we did is an organization came to us and said they wanted to do a test, a randomized control trial, on infant cord sites, because there are certain countries, because of cultural practices and other things, where the largest cause of infant mortality is infection at the cord site. So we did a nationwide RCT in Nepal, where it's a huge problem, and it reduced infections by 2/3 and reduced infant mortality by 25%. So it's actually a huge deal. It costs less than 25 cents to manufacture, because we manufacture it in India, in Nigeria, that sort of thing. So the innovation was really the evidence. So let me, I had said that one of the things that we believed is that there was hundreds, thousands of good ideas out there that USAID had never had a way of hearing about before. And that there were development actors and solvers out there that didn't even know that they had the solutions in their heads to solve these problems. So let me give you 3 really concrete examples. The first one is a gentleman, I can't remember his first name, his last name is Odon. Mr. Odon is an automobile mechanic in Buenos Aires, Argentina. And somehow, I don't even know how, but he heard about our first grand challenge, probably on social media, which was called Saving Lives at Birth. And Saving Lives at Birth was designed to end preventable maternal and child death within the first 48 hours of life. He heard about this grand challenge, and he was interested in the topic because his wife apparently had 3 very challenging deliveries, and with health scares each time. He had also just seen a video on YouTube about how to get a wine cork out of a wine bottle. So he went to his garage, it's a cliche, and he liked building things in his garage, and he built what turned out to be the newest commercially viable assisted delivery device, the first time that happened since the vacuum assisted delivery device and the forceps. He won the grand challenge, And Becton Dickinson, a large medical device firm based in New Jersey, bought the global patent rights, and they're now producing the Odon device. So first you have an automobile mechanic. The second is a small automobile insurance company based in Nairobi, Kenya. And the owner of this insurance company, their main clientele were matatus. Has anyone been to Nairobi or knows what matatus are? Did you raise your hand? No. Do you know what matatus are? The minibuses? They're minibuses. And it basically is what passes for public. It's not public, they're private, but essentially the equivalent of public transportation in Nairobi. They're oftentimes quite literally death traps. They're overcrowded, the drivers get in accidents, and so this gentleman who ran the insurance company was constantly paying out very high claims. So he had a business interest to reduce the number of accidents in the matatus. He had heard on the radio, a radio program from a Kenyan NGO that was using behavioral change approaches to change high-risk sexual behavior to reduce HIV/AIDS infection rates. So he reached out to them and he said, could you use some of that stuff to get the drivers to stop getting in accidents? And they said, yeah, sure, they can. So they applied to our Development Innovation Ventures program. And I'll show you, I have a picture of it later, the actual innovation. It's a sticker. With a sticker, they reduced accidents by over half and mortality by over half in these matatus. And the reason why we were so excited about it is that the single largest cause of death in sub-Saharan Africa now on young adults is now automobile accidents. And yet AID had no way, so this is a huge development issue. It's a huge public health issue. It causes billions of dollars of economic displacement each year, and we didn't have a way of doing anything about it. And now this group, this NGO and this insurance company, and they're working with Georgetown, is now applying other traffic safety methods and programs throughout East Africa. So an automobile insurance company. The last one is a wedding dress maker. Okay. So Ebola outbreak occurred last year, and immediately there was a mobilization of the sort of the public health corps in the U.S. where doctors got sent over to West Africa and to treat Ebola patients and nurses and others, and they donned the personal protective equipment, the Ebola suits that you guys have all seen in various like science fiction movies and Walking Dead and that sort of stuff. Well, funny thing happened when you're in West Africa and there's no air conditioning and you're working. These suits that work pretty well in Baltimore, where I'm from, or I'm sure in Ann Arbor when there's a lot of air conditioning in the hospital, or today when it's 11 degrees outside, they didn't work so well in West Africa. Doctors would put them on. It takes about a half hour to put them on. They'd wear them for about a half hour, 45 minutes, and they'd get heat stroke. So they'd have to take them off. And when they took them off, because they were physically impaired because of their dehydration, that's when most of the accidental contamination from the Ebola contaminants happened. Then they'd have to cool off after taking a half hour to take these off, and then they put them on again. So almost immediately it was clear that these doctors and nurses were only taking about a third of the day to treat patients. And the other two-thirds they were basically recovering or taking the suits off. So we launched a grand challenge with a ridiculously short turnaround time to design new personal protective equipment. Johns Hopkins University was very interested in it because, in fact, it was some of their doctors that were overseas. They partnered with Under Armour, which you guys have probably all heard of Under Armour, which is based in Baltimore, because Under Armour has world-class expertise on different kinds of fabrics. And they advertised a maker's fair in Baltimore that they were going to spend a weekend and they were actually going to make personal protective equipment and have it all be done in 48 hours. No one was going to sleep, and they were going to prototype to development in 48 hours. Well, there happened to be a woman that owned a wedding dress shop, and she also happened to be the head of costume design at a local theater company. And her best friend was from Liberia, and this woman was actually the godmother of her child. And so she felt a personal connection to the Ebola crisis, maybe more so than she had in the past in terms of other events happening in the developing world. So she was debating about whether she should show up to this thing. It was all going to be doctors and scientists, and what could she possibly add to it? It turned out she added everything to it. Because her expertise, well, one, she could make clothes like no one else around. But number two, she could make clothes that were designed to be taken on and off super fast, because that's what you had to do in a theater company. And they won. And they won because of her. Right? So there's now DuPont is building brand new personal protective suits because of a person who owns a wedding dress shop in Baltimore, Maryland. So that's our open source models for development. And I think like so far out of everything we've done, they've been wildly successful. So I want to talk a little bit less time about data iteration, but just sort of to point out that because of this rapid spread of technology in the developing world, particularly mobile phones and broadband access, there's now the capacity to generate huge quantities of data, oftentimes in real time, about development outcomes and projects. So for example, Uganda's really led the way in this. In fact, they did it out of frustration because all the donors, Uganda is a donor's darling. There's a huge amount of donor resources going into it, especially in the health and agricultural sector. And in the health sector, every single donor that was coming in put in place a new sort of real-time data system, and the government was going nuts. They said, we're spending all day, our people in the Ministry of Health and the people in the rural health clinics, entering in data into all of your systems. They said, we're not doing that anymore. Come to us with a single system. So the donors got together, we designed a single system, and that's now applied throughout multiple sectors in Uganda, including the health sector. But what happened is the year after we developed the system, so one of the sort of spin-off effects of this was they got a very large delivery of vaccinations, and they were going to send them out to the rural health clinics. And oftentimes they would send them out and they wouldn't have working refrigeration, and so the vaccines would just go to waste. So they texted everyone because all of them was on this system, and within 48 hours they knew for all of the clinics if they had a working refrigeration, and if they didn't, why not? Was it because they just needed fuel for the generator, for power? Was there a broken part? Did someone steal it? And so they were able to along with the vaccines, move out the fixes for the refrigeration. And that cost essentially virtually nothing. And they said in the past that would have taken them about 6 months to do it. Instead, they did it in 48 hours. So we could build in all of this data, and instead of using it from a project perspective, waiting till the end of the program and saying, well, what do we know about the program? We'll know instantaneously, and instead of just using it as a sort of learning tool afterwards, we could apply that learning while the programs are being implemented and allow us to iterate in ways that we just couldn't do a few years ago. We also recognize that USAID probably never got totally out of the business of doing sort of more basic scientific research, but got more out of it than we should have. When I say scientific research, I really mean development research, particularly development research that was happening in developing countries. Right? So we put in place some new programs, for example, one called PEER, where we would leverage research that was being funded by NIH and the National Science Foundation and pair those researchers with local researchers and have the research happen sponsored by local universities. So it was something that was immediately relevant to those countries. And so, like, for example, one example was looking at Mali, looking at malaria, which is the largest cause of mortality in malaria. In Mali is malaria. And for whatever reason, the normal both treatment and prevention routines weren't as effective in Mali as they should have been, is sort of what the evidence seemed to point out. But there was a scientist there, I think he was a doctor, who had an idea that we sort of helped fund to do research about whether there was a particular seasonal aspect of malaria in Mali that, while not unique, is pretty unusual. And therefore, whether that meant there had to be different routines in terms of treatment and prevention. And so this is the type of sort of basic development research that USAID hadn't really funded a lot of recently. So we wanted to really start that process again and really do more sort of research and evidence. So I'd like to also talk some about scale and sustainability. What I mean by scale is applying some of these programs at, moving beyond the pilot stage and applying them across entire countries or across multiple countries. And that's sort of the holy grail for donors. It's very hard. We struggle with it. It's really only happened a handful of times in things like microfinance or the green revolution or oral rehydration therapy, which is, you could again go to CVS and buy Pedialyte. But this is a approach that saves tens of millions of children's lives from dehydration and diarrhea. So we know it could be done, but it's really hard. It's very difficult to figure out how to scale approaches and programs. So one of the things we want to do is build in that to the beginning of our design process and really measure our success at our ability to scale things. And so we have sort of 3 areas that we're really trying to do this now, or 4 areas. So one is on electronic payments, and I'll talk about that and why we're doing that. And we're also working in conjunction with others in the agency, looking at healthcare system strengthening in West Africa across the sort of Ebola-affected countries. We're doing it in terms of off-grid energy, where we think we have a big comparative advantage in the lab to design sort of sustainable business models to provide off-grid solar power to homes in the bottom of the pyramid. So we're trying to scale those approaches. And then also we're trying to, what we're calling digitizing feed the future. So we have, the US government has a huge food security sort of agricultural development program. And we're trying to put in place sort of more modern technological approaches to leverage all that investment and yield better outcomes. So I'll talk a little bit about, particularly about electronic payments. I don't know how many of you have heard of M-Pesa, for example, in Kenya, but basically it's obviously a lot of you have, and that's good. But the notion of electronic payments on the face of it is really simple, is that you could use your phone to buy or sell things, right? Or you could go to a retail establishment and use electronic payments to buy food or commodities or whatnot. But it's actually way more than that. In sub-Saharan Africa, there are about 30,000 ATM machines, which is not a lot. I don't know how many there are in Michigan, but it's way more than 30,000. And 20,000 of those are in South Africa. So it's even worse than that. So it's basically the entire continent essentially doesn't have ATM machines. But there's over 700 million mobile phones. And in theory, each one of those has the technology to not just be an ATM machine to sort of get money out or save money, but actually to radically accelerate financial inclusion and give people access to credit, to insurance. And so in Kenya, where you had a massive scale through M-Pesa, a very successful model for digital payments, you had all these other financial services that piggybacked on it. It was really revolutionary. And it has a measurable positive benefit at the household level on health outcomes, on sort of resilience to agricultural shocks for subsistence farmers. It's a real big potential win. And we like it too. It's a real big potential win for donors. We put all of our programs essentially on M-Pesa as well. And for us, that saved a huge amount of time and money. You know, before that, we were dealing, and most of our programs in the world still, I'll talk about how we're changing that, we're dealing in cash. So imagine how much money you had to pay for security when you were going out to a rural area with bags of cash to pay for, you know, conference space or to pay for salaries or pay for other things. So we saved a lot on security, in some cases like a 90% reduction in the security line item. But also, it turned out, and I'll talk about Bangladesh in a second, it turned out it freed up huge amounts of time. Some of our projects, when we switched to electronic payments, were saving tens of thousands of people hours a year that was used to sort of ledger books and all this other stuff. The problem is that unlike Kenya, in most places, it hasn't scaled yet, that you actually need a critical mass of people that are utilizing electronic wallets, in essence, before both the financial and the retail sectors will sort of crowd in. And so you need that critical mass. And we thought that one of the things that we could provide as an agency is we could help nudge that critical mass. So we do it in two ways. One thing is we have new regulations that, unless it's not possible, every single grant and contract now that USAID does, they have to use electronic payments. And so that's a way of both creating supply and demand in the system. But the other thing is that a lot of the barriers were really like regulatory barriers, right? So our comparative advantage is not to pick a particular software application or product to do mobile payments, but we did have a comparative advantage to work with governments and financial institutions and large sort of multinational corporations to put in place sort of a series of practices around it. So governments sign up. We have something called the Better Than Cash Alliance. And they sort of commit to making both sort of telecoms and financial regulatory changes. And like, say, CocaCola signed up. And what they committed to do was, through their supply chain, to use electronic payments. That's a huge thing, right? So all of their logistics stuff, all their payments for their bottling plants and everything. So we're trying to really galvanize and scale electronic payments. This segues nicely into, we want to focus on enabling technologies in the lab. So again, we don't feel like our comparative advantage is to develop software or come up with an app for mobile health. There's hundreds of apps for mobile health. We want sort of the market to figure out what's the best approach. But we have a comparative advantage at that sort of policy and regulatory level. So we had Better Than Cash Alliance I talked about. We also have something called the Alliance for Affordable Internet. Because there's huge inclusion problems with internet access, where even if increasingly large geographic areas have mobile broadband access, there's not major affordability issues because of monopolies, state-run monopolies, telecoms monopolies, et cetera. So it costs more on a real dollar, or at least it used to a couple of years ago, on a real dollar basis to get mobile broadband in Lagos than it did in Monaco. Right? So there weren't a lot of people at the bottom of the pyramid, or even close to it, that could afford internet access, even though it was in theory available. So we launched the Alliance for Affordable Internet. We're also working really hard to try to close the gender gap in mobile phone ownership, because there's a huge gender gap. And we know that, for example, if you pair access to a mobile money account and you have inclusion in terms of gender inclusion, you have much more of a development impact, because women oftentimes will end up using the savings and the income much more responsibly than the men in terms of using it for education for their kids or for health care and that sort of thing. So we're trying to sort of pair those things. So again, we feel like our comparative advantage has put in place the enabling environment that will allow these technologies that are emerging, or ones that are exploding, to have a more effective or real development impact. So I want to talk a little bit more detail about public-private partnerships, because I think it's probably something that this audience would be interested in. So USAID has been doing public-private partnerships intentionally and deliberately and to a sort of a large scale now for over 10 years. But our thinking recently has dramatically evolved. When we started doing public-private partnerships, mostly we worked with the corporate social responsibility arms of multinational corporations, to be honest. And so it made them feel good, and they wrote us a check, which was fine. So we used the money, and we were able to then sort of get more bang for our buck in terms of our projects. Not a bad thing, but there wasn't a lot of commitment on their part, right? It was not core to their profit and loss part of their business. That's kind of short, narrow thinking on our part, though. Because actually what's happening in the developing world is the survival of so many of multinational corporations over the next 20 years is completely dependent on what's happening in the developing world. Whether they're tech companies or consumer good firms, right? Their profit, their customers, their employees, they're all coming from the developing world in the next 20 years. Right? And the biggest source of demand for things like energy investment, and infrastructure, and all those things. So they actually care really deeply if the populations in these countries are healthy, if they're well educated, if they have disposable income. So we figure that out, but they figure that out as well. So we've changed our approach to public-private partnerships quite dramatically, where we're really looking for now shared value. Right? If you want to cut us a check from the corporate social responsibility arm, we're certainly not going to say no. But what we're really interested in is, what do you see that has a development outcome that is core to your succeeding as an industry? And where's the overlap with what our development objectives are? And let's build a public-private partnership around that area. Right? Let me give an example of CocaCola. I'll give a couple of Coke examples because I'm just, for whatever reason, it's on my mind. But one thing that was really cool, so for example, I don't know how familiar you are, and I'm not a business guy, I'm a democracy guy, but Coca-Cola's business model in the developing world is, they create enterprises in the countries, both for bottling and distribution. Right? So it's not a centralized thing from Atlanta where they ship everything. And so it really requires a lot of entrepreneurs in these countries for their models to succeed. And so they had reached a sort of a saturation point in sort of the upper, sort of the lower middle income countries in Africa, and they wanted to expand their geographic reach into some countries that were poorer but also less stable, more prone to corruption, et cetera. So they approached USAID and said, we're interested in moving into these countries. You have established relationships there. Could we work together on it? And we said, absolutely, we'd be happy to do that. We could sort of help you navigate some of these waters and identify good people to sort of training opportunities for entrepreneurs. But what about if those entrepreneurs are women? Again, for that same reason. It actually has a much better development outcome if the owner of that sort of small or micro enterprise is a woman. And we wanted to promote financial inclusion and gender equality. Well, it didn't matter to Coke, right? They just wanted entrepreneurs. And they said, okay, well, we could do that. And also, a lot of the skills they were teaching weren't just applicable to Coca-Cola. So we said, well, what if we co-fund and we'll train a whole bunch of women entrepreneurs, even if they're never going to work at Coca-Cola? And they said, yeah, sure, we could do that. And so they actually went even farther, and they launched a program. I think it was called 15 by 20 or something, where it was going to be 15 million entrepreneurs they were going to try to train by 2020. So we try to leverage resources, but we also try to leverage the expertise of our private sector partners, because they have capacity that dwarfs our own in a lot of really important areas, especially things like supply chain, logistics. So again, with Coca-Cola, you could get a Coca-Cola practically any village in Africa. You can't necessarily get anything else. We have a hard time getting things there. Even the governments have a hard time getting things there. So now they allow us to stick commodities, medical commodities, agricultural commodities, on their trucks and take them out there. It doesn't cost them a penny. It doesn't cost us a penny. We didn't have to recreate whole logistical networks. And then we want to catalyze markets. And our value added here a lot of times is risk capital, right? We're a small player when it comes to these huge markets, right? But what we could do is we could provide risk capital where we will, for example, the Saving Lives at Birth with Mr. Odon and his device. We essentially created a market that Becton Dickinson didn't know existed. We did all the due diligence. We did the initial investment. We tested it, right? And then they swept in and they bought the global patent rights, which we never could have afforded, and they're going to scale it in a way that we never could, right? So we essentially catalyzed a market that the private sector didn't even necessarily know existed. So let me go a little bit more on innovation, but then I want to give time to okay.
I'm just curious. I mean, a lot of this is strategically very relevant in the development discussion, and I'm wondering how your lab in particular has overcome a lot of the challenges that arise from operations, such as procurement rules, contracting, and things like that.
Yeah, good question. We'll jump ahead. I won't literally jump ahead to the slides, but so there are real constraints. So the reason why some of our critics of USAID are right, there's real reasons sometimes why our processes are slow, why it's hard to crowd in solutions from a variety of people, and we do because we obviously have to follow the laws, and you would probably not be that surprised that there's a thing called the Federal Acquisition Regulations, and there's something called the Code of Federal Regulations Section 226, or 223, which is grants. And if you added the two together, they'd probably be almost this high if you started on the floor. And one of the biggest problems from that, from a USAID perspective, is that it creates a firewall where we sort of think we have some good ideas, and we tell people what we think those ideas are, and then they get together and they write a proposal that tells us what good ideas we had. And then the people that we think are most convincing, and by the way, this is really cynical, I recognize, and it's not really this bad, but, and then we fund them, right? It'd be much, much better if we could sit down together at a table and co-create with them and say, look, we're really wrestling to try to solve problem X. Let's bring together a room full of people that are experts at X, and let's solve it together, and then let's design a program together to solve that problem. So we did create something that allows us to do that. It's called the Development Innovation Accelerator. And so like our open innovation platforms that have been hugely successful based on sort of the demand that we've gotten from external audiences, and by the way, other donors that are partnering with us left and right on them, this Development Innovation Accelerator has been wildly successful in terms of the demand that it's generated within USAID. Everybody wants to do this now. It's completely turned things on its head. Actually, the programs that we have at the William Davidson Institute on monitoring evaluation were designed using this instrument. And it blew my mind because I had been doing the normal procurements for 20 years, and I got to sit down with the actual people and from sort of day one and just design things together. It was awesome. So that's like one way we're doing it. But it is, so one of our second objective, which is the transformation of the development enterprise, it really does involve a lot. We have a whole team that's called the Operational Innovations Team. And so their only reason to exist is to come up with ways to sort of hack the bureaucracy and allow us to do things better. And so they do that. They've got new personnel stuff, new procurement stuff, which maybe to everyone else besides me sounds a little boring, but is super exciting if you actually work at USAID. So again, sort of focusing a little bit more on our innovations and sort of trying to emphasize for us, it was a big cultural shift. So we try to be really deliberate to treat our innovations as a sort of a pipeline, like sort of an R&D approach, where we do a lot of big bets at the very beginning, or a lot of small bets at the very beginning. Small amounts of money, short programs, and then we're ruthless and we just start cutting the ones that don't work. And by the time we get to scale, our sort of assumption going into it is that for every 100 ideas that we source at the beginning, we'll be happy if one of them goes to global scale. Now that's a little different from USAID, because at USAID, we're conditioned for a lot of reasons to talk about that everything is successful and that you don't fail. We've built in a model that says we're going to fail 99% of the time, right? If we're saying success is that we're going to find something that's so good that we're going to scale it all over the world, that we're going to fail 99% of the time. What that means is that we really have to rigorously test things. So, for example, one of our programs, the Development Innovation Ventures program, over half of those grants have randomized control trials, impact evaluations. The normal rate at USAID, I think, is less than 1%, right? So we're trying to really, if we're going to cut things ruthlessly, we need to really have a strong evidence base to say this just isn't working. This here, that's one of the stickers that is in the mutates that I talked about. So basically, don't let a reckless driver get away with murder. And they're all essentially variations on that theme, like stand up and scream at the driver if he's going to get you killed. But the behavioral change innovation there, that was one part of it. The other part, which was interesting, which this NGO came up with, was that they had a raffle, a lottery each month, and they would randomly draw the number of the mutate. And if they had the sticker up, they got a month's salary. So none of them tore down the stickers because they all, even though people were screaming at them to drive better. And what we paid for, actually, was we didn't pay for the stickers, right? I don't know how much stickers cost, but in Kenya, they're probably even cheaper. We didn't pay for the salary. That was done by the insurance company. But we paid for Georgetown to do a randomized control trial to see if it reduced traffic accidents and fatalities. And so we did that initial grant. It was less than $100,000, and it spawned an organization that we've now funded for a few $1 million to do traffic safety stuff across East Africa. So are there other, I don't want to talk the whole time. I want to, yeah.
I'm really interested in how you guys go about evaluating your potential grants or investments. I mean,
yeah.
You're not taking an equity position.
We're not allowed to.
Yeah. So you're not doing that. So how are you able to say, like, whether something is better than something else at this very early stage oftentimes? Are you trying to look at people, diseases?
Yeah.
How is that impact measured?
So the short answer, and I'll give a slightly longer answer because the short answer won't be very helpful, is that it really depends on the program. But if you use, for example, if you use our Development Innovation Ventures program, when they submit their proposals, there's several things they have to do, but two of them that are really clear is they have to say, well, what is the specific problem that you're trying to solve, and how are you going to measure whether you're doing it? And so they essentially tell us how they should be tested, and then they have to tell us how they're going to do that test. And it really depends on where they are in that pipeline. So if they're early stage, a lot of that is really proof of concept, right? So that might be if something's supposed to happen when you push the button, we need to know if that actually happens when you push the button. When you're later on, you're measuring for much broader development impacts, right? So that could easily be having randomized control and treatment groups. If it's something about water sanitation and hygiene, that we would want to test for waterborne diseases and diarrhea outbreaks among children, for example. So it depends on what we're trying to do and where they are in the stage. But like I said, we use, for example, RCTs and other sort of more rigorous evaluation methods much more often than most of the rest of the agency does. I don't know. Does that answer your question?
I just know you guys have a limited pool of funds, and
yeah.
I just think, assuming you have thousands of items coming in, and so how do you reconcile?
Okay. Well, that's So a slightly different question. So actually, the one downside to our success in our how many applications we're generating. So one downside is people don't get to sleep when they have to read them all. But the other thing is our acceptance rate is super low. It's less than 10%. Because we have so many great ideas and we do have a limited amount of funding. But we also put pretty high standards on them. Particularly, so I think we try to be very And for DIV, for example, the DIV program, we have 3 screenings. So we do a really quick screening on all of the expressions of interest that we get on a quarterly basis. So it's open 24 hours a day, 7 days a week, 365 days a year. But every quarter we sort of freeze it, and we look through all of them, and we do an initial screening. And then the ones that pass the initial screening, we have sort of a peer review, outside reviewers that come in from universities, but also from NGOs, other donors. And then we do a final internal screening. And so I think that's part of it, is we're just really picky.
So I'm curious, I know you talked about providing grants.
Mm-hmm.
What other ways are you providing assistance? Is it mostly monetary grants to scale,
Mm-hmm.
or is it also assistance in helping create evaluative tools,
Mm-hmm.
or help implement programs? I'm just curious about some of the different.
No, that's a good question. So at its heart, USAID is a funding agency. So a lot of the work we do is through grants and contracts. But we also recognize that simply doing that is not going to yield a lot of the impact or change we want. So we're trying to galvanize sort of knock-on effects. And so we do use money for that often, although we do a lot of that work ourselves. So you actually touched on 2 of the things that we're doing that have sort of the knock-off effect. So we are actually, for example, sourcing new ways to measure the impact of innovations and do monitoring and sort of do program management. So that's one thing. But also we try to look at, so a lot of what we're doing, we're trying to look at the ecosystem level. Right? So, for example, the support that we do to social enterprises, although through some of our grant programs, admittedly, we give grants to social enterprises, especially at the early stage. But again, we think the market should sort of decide. We don't necessarily want to be the people that arbitrarily say this social enterprise is better than this social enterprise. So a lot of what we do is we provide ecosystem support, where we say, could we help create an intermediate service organization that could provide business skills training to these social entrepreneurs? What can we do to galvanize finance? Right? So a lot of what really kills the social enterprises is they get to a certain point and they've been getting donor financing, but to really scale, they need to get debt financing, loans from local banks, et cetera, at a much greater amount of money than we could do it. So a lot of our work in social enterprises now is actually designed at the country level to unlock capital for these social enterprises rather than for us. So one of the examples would be there's a social enterprise called Off-Grid. So it's capital O, capital G, and they do off-grid solar in Tanzania. And they actually are the first organization that got grants at all of the stages in our Development Innovation Ventures program. And we funded them because their business model, unlike a lot of the off-grid solutions where the households are renting or buying the equipment, they're providing electricity as a service. So you don't own the equipment, but then when better equipment comes on, they'll come out and install it in your house. And it turned out to be a really viable model, and they're in Tanzania, but they needed more money. And so we put $5 million on the table, and we said, this isn't a grant for you to use. This is sort of risk capital. Go use it to raise other funds, and we'll actually disperse it to you once you get $25 million. And it provided, again, sort of that risk capital for local banks, because we had done the due diligence. We were putting our money on the table. And so now they're starting to get much larger loans, and they're soon going to be able to reach 1 million households in Tanzania, which is a huge, huge win for us. Other questions? Mm-hmm.
Sometimes a lot of technologies are designed for a particular context and they work really well.
Yes.
But they don't necessarily scale across.
That's right.
The country. And so I wonder how does the DPL sort of evaluate those kinds of proposals?
Yeah. No, it's a great question. So we developed a framework early on that we're still tinkering with, but it's essentially designed if you could sort of, in theory, take any solution or innovation. It certainly doesn't have to be one that USAID supported. It could come from anywhere. And we wanted to be able to answer 2 fundamental questions about it when it comes to scale. So the first is, should we scale this? In other words, what is the evidence of impact that shows that it's able to provide a development impact that's better than what sort of the standard of the current approach is? And by the time you're talking about scaling something, it should be a really rigorous, right? There should be multiple pilots. There should be a really rigorous evidence base about that. But the other question, which gets at exactly what you were saying, is can we scale this, right? Does this solution possess certain characteristics that lead us to believe that it could be applied successfully in multiple geographies and multiple contexts? And there are certain things that just simply can't. You're absolutely right. Or they don't necessarily need to be because they're trying to solve a problem that's unique to a particular country. So we do try to address that. So a lot of times what happens is people say, this works really well, let's scale it. And they don't ask sort of the right questions about, well, can you actually scale it regardless of how well it works?
Can you speak a little bit about implementation of the projects or, I guess, objects that you choose to fund?
Mm-hmm.
If that goes through a consulting agency or how kind of those get implemented?
Sure. So we've got sort of multiple models. The largest sort of biggest picture, we have a lot of what we call multi-stakeholder alliances, where we bring together actors, governments, donors, private sector actors, to try to sort of build some sort of global public goods around, like I said, sort of internet access or affordability. And there's a lot of big ones that the lab doesn't even touch around agricultural commodities or Gavi or those sorts of things. But that's certainly one implementation model we have. The other extreme are really small grants that we're providing directly to NGOs or social enterprises or local governments, and really the sort of the whole range in between. We do provide assistance to what we would call sort of traditional USAID implementers, but we have a much wider, sort of broader group of partners than most parts of the agency do. And so we do, grant mechanisms and TA, and I don't know. Does that answer your question? Other questions?
So my question is related to the e-payment system
Mm-hmm.
trying to roll out and make sure that donor agencies or partners that you work with those African countries
Mm-hmm.
adapt to it.
Mm-hmm.
I'm originally from Ghana.
Okay.
Africa, so I'm very familiar with the cashless system going on.
Yeah.
And past semester, I did some studies. I wrote a paper on Econet, which is actually rolling out this same platform to facilitate the cash, to kind of eradicate the cashless system.
Excellent.
Going
Mm-hmm.
on. So my question to you is, these programs are actually carried out in rural areas, and
Yes.
the people there are really illiterate, if I can put it
Mm-hmm.
that way.
Mm-hmm.
So trying to get them adapt to this new system, I feel like it's going to be a challenge. Another thing I see coming through is, I feel like they need more education on that front.
Yeah.
This education could be in the form of their local language, or knowing that most of them are not familiar with their speaking English.
Yes.
So that's one thing a hurdle I see. Another thing that I'm thinking of is their internet connection into those local areas. They don't even get the network doesn't even get that far.
Yes.
So with all this in mind, I'm just wondering, are you partner with this network providers?
Mm-hmm.
What is the mechanism you have with this? How do you intend to do this? Because eventually, you're working with these partners who are in these local areas.
Yes.
Like rural areas.
Yes.
But eventually the money goes to individuals that you're working with in those rural areas.
Mm-hmm.
So how do you intend to deal with that?
Yeah.
And if you had any challenges so far on that front?
So we've definitely had challenges. I would say, so first in terms of illiteracy or innumeracy, I think that is a significant issue, and one that certainly AID works on, but I think we don't work on it directly in the context of working on sort of electronic payments programs, but you're absolutely right. But in terms of the access, internet coverage and affordability, that's definitely something we work on. So two of these I talked about multi-stakeholder alliances. Two of them are designed exactly to do that. And part of the alliance members are the governments themselves, and then they commit to doing certain things. And a lot of it is on regulatory environment, right? Is that, if you have telecoms monopolies, a lot of times, well, there's no incentive for them to necessarily provide, there's a lot less incentive for them because there's no competition for them to provide affordable service necessarily, or provide effective service, or have a broader geographic area to the rural areas because, the urban concentrations probably works better for their business model. So a lot of it is breaking down those monopolies and those barriers, but then you also need to, a lot of times you have to help rewrite the financial regulations. It's not just the internet access, but it's laws about what a financial institution is and isn't, and what if you've got folks that own shops that are going to be hubs for mobile payments, well, they start looking like a bank, right? So what regulations cover them? And then you need to work with the retail establishments to get, no one's going to sign up for a system to electronic payments if they can't actually buy anything with it. And so a lot of it is really sort of a chicken and egg thing. And so what we try to do is basically try to do it all in one big package together, because otherwise something's going to mess up, gum up the system.
So kind of a follow-up to that. This seems like a little bit more market-focused than kind of the traditional working with the ministries. But then obviously there are intersections of that. What are some things, or whether it's challenges or techniques that you've used to get the ministries of health or ministries of finance, these different countries, to be on board and supportive?
That's a really tough one, and I'm answering very much with my original USAID hat, which was on democracy and governance. So, in some countries we work in, certainly not every country, but in some countries we work with, the biggest barrier to development is the governments themselves, either oftentimes deliberately because of the policies they're putting in place, but sometimes just capacity issues. But and so there are certainly circumstances where working with ministries is extremely challenging, right? Because particularly if it's an area like natural resources and other things where there's sort of rent-seeking opportunities. And so the last thing they want to do is necessarily open up things to, let the markets decide. They'd rather decide themselves. So that's pretty challenging. Less so in health ministries, frankly, than some of the other ones, but it's definitely there. And I think partially by making, on the other hand, things like Better Than Cash Alliance or Alliance for Affordable Internet, it's not like some sort of big UN thing that you're going to strong-arm someone to do. Like, we put it out there, and we want the governments to come to us and say, this is something that we're committed to. And they have clear commitments. And again, there's not a sanctioning regime. It's not like we can punish them if they don't live up to it. But I think we're trying sort of not to go out there and impose a model where there's not the political will for it. But political will is oftentimes our biggest problem.
So I think with that, we're going to stop the questions in here. We have some hors d'oeuvres outside where we can continue the conversation. But would you all please join me and thank you, Josh, for the
Thank you. Oh, thank you. Awesome. Thank you very much, everyone, for coming out. I really do appreciate it. And thank you to William Davis Institute and the Ross School for having me out and hosting this event and everything. So thank you very much.